Good morning, good afternoon, and good evening. Welcome to today's discussion, Healthy Planet, Healthy People, Navigating the Intersection of Climate Change and Universal Health Coverage. My name is Dana Sandstrom Keating, and I'm Vice President of Strategy, Business Development, and Partnerships and Management Sciences for Health. In preparing for today, I've been reflecting on how the first time I stood before a crowd to discuss climate change, I was 12, and my audience was an auditorium full of fellow sixth graders. I'm personally motivated to be with you today, and on behalf of Management Sciences for Health, we're delighted to host this important discussion to celebrate Universal Health Coverage Day and to mark the end of this year's COP28 climate conference. Before we begin, I would like to share just some quick housekeeping items. We will be offering simultaneous translation of this conversation in French. To choose the French audio feed, click Interpretation at the bottom of the screen and select your preferred language. You may also view subtitles by selecting the live transcript button at the bottom of your screen. And the whole point of webinars like these is to engage. You can submit questions to the panelists by using the Q&A button at the bottom of your screen and entering your question in the pop-up box. Finally, you can continue the discussion by using the chat function at the bottom of the screen. For those of you who are not familiar with Management Sciences for Health, we are a global health nonprofit working in more than 40 countries. We have worked shoulder to shoulder with countries and communities for more than 50 years to save lives and improve the health of the world's poorest and most vulnerable people by building stronger, more resilient health systems. We recently launched our 2023 to 2030 strategy aligned with the Sustainable Development Goals. A major strategic focus for the organization over the next 7 years is on helping countries build more resilient primary healthcare systems, including responsiveness to climate change, disease outbreaks, and pandemic preparedness. We also have the ambition to chart a path toward carbon negative business operations over the course of this strategy. Climate change affects health differently in every country where we are working, and we have seen that firsthand. We know that we will not achieve universal health coverage unless we support locally driven responses to these complex challenges. For example, in Guatemala, where MSH is working with the Ministry of Public Health and Social Assistance and 3 consortium partners, PS de Occidente, OSAR, and the Universidad de Valle de Guatemala, to increase Indigenous women's early access and adherence to antenatal care services and improve the quality of culturally relevant antenatal care, climate shocks had driven households to shift to cultivating corn almost exclusively. Nutrition outcomes suffered due to lack of dietary diversity. Acting on what the data was telling us, we were able to work with partners and stakeholders to adapt their antenatal care model to include nutritional counseling for Indigenous women. In Benin, MSH partnered with the Ministry of Health to adapt the schedule of seasonal malaria chemo prevention campaigns in response to data that showed changing weather patterns had led to an increase in malaria cases a month earlier than usual. And in Ethiopia, MSH's Health Resilience Activity Program works to strengthen subnational capacity and systems to manage public health emergencies. We're working with partners and stakeholders to conduct health vulnerability assessments, which help local leaders anticipate and plan for climate and other shocks. Better insights and planning helps local leaders drive their own preparedness plans for adaptation and response to climate change. It's a huge deal that 200 countries committed to transitioning away from fossil fuels this week. But the effects of climate change on health are already here. Scaling up effective local solutions to meet these complex challenges is critical. I look forward to hearing from today's speakers about how we can do just that, and to many, many more conversations that will drive country-to-country collaboration and learning. And with that, I will turn it over to Stella Paul from the Internews Earth Journalism Network, who will moderate today's discussion. Stella, to you.
Thank you very much, Dana, for perfectly setting the tune for this conversation. And with that, a round of welcome to everyone who's just joining us at this very moment. And yeah, good morning, good afternoon, good evening, wherever you are. As Diana just said, today we are going to focus on climate change and health. I was in the COP, and I'm just coming out of the COP actually right now. And we have seen some very, very exciting development that happened at the COP that includes, for the very first time, we saw a health declaration that has been signed so far by 142 countries, and it's the very first time all these nations have come together to collectively admit and acknowledge that there is a very strong and distinct connection between climate change and health, and that they need to also collaboratively work to tackle this and help support their own people to deal with these health challenges that are climate change induced. Now we will be having a lot of conversation on this, and to do that we have an excellent, you may have seen this while registering for this webinar, that we have an excellent lineup of panelists, and it's really my great pleasure to briefly introduce them to you. So let me first start with, on my left, I have Eliza Love. She's the technical advisor for health financing and policy at MSH. We also have Eri Lansmanaputra, who is the country director of the Medicines, Technologies, and Pharmaceutical Services program in Indonesia, also from MSH. And last but not least, we have Dauda Diouf, who is the head of climate action and health resilience at Foundation S. For those of you who may not be familiar with Foundation S, is the Sanofi Collective, also known as the Sanofi Collective, the new philanthropic organization of Sanofi. So we will be hearing from all these three brilliant panelists on different aspects of how climate change and health intersect, and where are we right now, and where do we need to go, and what needs to be done to take us from here over there. It's my great pleasure today to first invite Eliza. Eliza, I know that, as Dana said right in the beginning, that working on climate change and health, it has been something that MSH has been working on in an area for quite some time. But I guess that there is also something, working with different communities apart, you are also conducting studies and coming out with a lot of information. I think that could benefit a lot more people, including those of us who are at this webinar today. So I believe that there has been a joint study done by MSH and Foundation S, and it's fairly new. So could you please tell us about this? I'm very curious to know the key findings of this report. What was it? What did you find? Please, the floor is yours from here.
Thank you, Stella. Hello, everyone. It's a pleasure and honor to be here with you all and alongside these esteemed panelists. As the co-lead of MSH's Climate and Health Technical Working Group, I work with our colleagues from around the world to support strengthening the climate resilience of health systems. As we saw the focus on health at COP earlier this month, as Stella noted, I'm encouraged to see the focus on climate on this UHC day, and I'm thrilled that MSH is elevating the importance of climate action in achieving UHC in the dialogue today. This year has been yet another reminder that the climate crisis is not some future scenario, but an everyday reality. And it is certainly a health emergency. In my own home state of California, where I'm calling in from, mega droughts and rising temperatures have aggravated by climate change have increased frequency and intensity of our wildfires, with half of the state's 20 largest fires in history occurring over the past 5 years, aggravating air pollution, exacerbating inequalities, and severely compromising continuity of access to quality healthcare. While the impacts of climate change are affecting us all, the burden is not shouldered equally. Countries and communities who experience the most significant and unrelenting impacts have contributed the least to its causes and have limited access to the significant resources needed to protect themselves from its consequences, jeopardizing progress towards UHC and further widening health inequalities. So addressing this climate inequality is not only essential to achieving UHC, but also a matter of justice. As has been discussed at length over the past few weeks at COP, the international community must urgently phase out fossil fuels, which are by far the biggest contributor to climate change. It's imperative that this is done quickly, fairly, and with high-emitting countries providing sufficient financing for all countries to implement clean energy alternatives. The health sector itself contributes to around 5% of global emissions, and decarbonizing health systems must be prioritized in our agenda. It will be impossible to achieve UHC in an unmitigated world, and a healthy future is only possible in a low carbon future. However, rapid and wide-scale adaptation is needed to prepare for, minimize, and ideally avoid impacts which are already adversely affecting human health and health systems. Climate change threatens to undermine the hard-won gains made in UHC through intensifying negative health outcomes and exacerbating health system disruptions. So local communities are best placed to build effective, efficient, and sustainable solutions embedded within local contexts and tailored to local systems. Communities are central in driving solutions for climate action. And as Stella, as you mentioned, I am getting to it. We had the opportunity to work with Foundation S and my colleague here on the line and the Collective Minds Climate Council to develop an action report highlighting the urgent need to prioritize locally led adaptation in building health resilience to climate change and putting forth some practical ways to accelerate that action. So the report itself outlines 4 key areas that the council identified, which are putting local communities at the center of decision-making, building and applying evidence on local solutions, channeling flexible financing directly to communities, and fostering an enabling environment for local adaptation. But how can these principles be operationalized? Many might be asking. There are many examples of how this is already being done well that can be replicated and scaled. We don't need to start from scratch, even though more evidence is needed. But for example, by following Indigenous-led land stewardship practices, by implementing community-led development and management of early warning systems, by simplifying access to flexible financing for health and climate at local levels, and by devolving leadership of adaptation planning with representation from health and community leaders to ensure that health is at the core. However, for communities to be able to do any of this, increased quality and quantity of financing is urgently needed. According to the 2023 UN Adaptation Gap Report, even the most optimistic estimates show a gap of 194 billion per year, which is over 10 times the amount of adaptation funding available now. And of that current adaptation finance, only a tiny, tiny portion, less than 0.5%, goes towards adaptation efforts that specifically address health. So while the outcomes of COP were not perfect, I'm encouraged by the partnership solidified and the commitments that have been made towards addressing these gaps at the first ever Health Day. The Global Fund and the Green Climate Fund, 2 of the largest multilateral health and climate funds, have committed to strengthening their partnership in tackling these deeply interwoven climate and health crises. And the commitment of $1 billion to climate and health solutions made on Health Day by a various set of donors was a welcome first step, with its emphasis on transforming health systems, addressing environmental determinants of health, and ensuring climate-exposed communities are protected. One specific line delivered at COP28 from Shweta Nayaran of Healthcare Without Harm that resonated with me was, "Let us not view health as a casualty of climate change, but as its compass, guiding us with just and equitable solutions." With health and UHC as our compass, I'm hopeful that we can create a just and livable future that leaves no one behind. And with that, I will hand it back over to you, Stella. Thank you for asking me the question and my long-winded answer.
Thank you, Eliza. I think, you not just shared with us the key findings of a report, but you also very effectively kind of summed up the entire finance scenario as it exists right now in the COP, across different funds, that the need is increasingly growing. That's because of the growing impact of climate change and the actual fulfillment of the pledges. We are having a lot of pledges, of course, but the actual fulfillment of pledges for financing is still way too low and far less, very, very inadequate at this moment. Now, thank you also, sharing with us the key findings of this report, and thank you to our backend team here for sharing the links. Those who may have missed it, if you can scroll up a little, you will see this link to the report that Eliza just mentioned. Now, one of the things that really stuck at me, Eliza, was simplifying the access of communities, to healthcare as well as to finance. That to me actually would also mean strengthening the healthcare infrastructure itself. And this is where I think Eri, who has joined us from Indonesia, is the perfect person to come in at this point. So Eri, we know that, a few facts about Indonesia's climate vulnerability is pretty well known to a lot of people. The sea level rise, the inundations, even, Eliza just mentioned air pollution, or Dana had also said that. So air pollution has also been a health challenge, but I'm guessing that what collectively they mean, what kind of burden they create on the health infrastructure, or the kind of health challenges that it all brings to the communities, especially on the front line. Not everybody is very much aware about. So if you could share your experiences and insights into this, I think this is going to help a lot of us to get a better understanding. So take it away from here.
Okay, Stella, thank you very much. So, thank you all for your opportunity to me to speak and to share about Indonesia and how the challenges and climate resilience and access to universal health coverage in Indonesia. Next. Yes, so Indonesia is the fourth most populous country in the world, India, China, and USA, right? And also consists of 38 provinces, 460, 460 districts, 98 cities, and 83,800 villages. Tropical countries that lies along the equator. So two wet and dry seasons, but nowadays that this season is unpredictable. Sometimes dry season, but rainy, or dry season and with the many rainies, right? So it's just it's hard for us to predict the seasons and its influence to health and agriculture. So average annual temperature 26 to 27 degrees Celsius, and tends to increase and become hot, and it's not really comfortable sometimes out there. And we also, the Indonesia is a low middle income country. Health insurance program covers almost 97 of total population. This is part of the USH program. For your information, that 52% members paid by government. And we have 2,600 hospitals, about 10,000 primary healthcare providers. And in Indonesia, MSH are implementing 2 projects. MTAPs, most focus on the health technology assessment and pharmaceutical expenditure, and also Bebas TB just recently implement to support our government for tuberculosis program. Next, please. Yes, we know that the response of climate change, there is two main focus of mitigation and adaptation. So for the mitigation, we do the reduce greenhouse gas emissions, reduce deforestation, waste management, community change behavior to prevent pollution, floods, etc. And also MSH plan to have a net zero carbon, right, in offices and also for project implementations. Adaptation, this is mostly the health focus, that the fact that the environment keep changing and community have to do the adaptation to manage climate change impact. So it consists of preventive, curative, rehabilitative, applied technology development, etc., etc. Next, please. This is the figure of Indonesia. Indonesia, one of vulnerable countries, the impact of the climate change, right? And you know that the archipelago country, Indonesia, have about 17,000 islands, and also risks such as have a risk of vulnerable in climate change just because of rising sea level. And from 2010, 2018, national GHG emission experience is a growing trend around 4.3% per year. And also the temperature, I mentioned before that the 0.03 degrees as per year, right? And also Indonesia experienced a sea level rise 0.8 to 1.2 centimeter per year. Now in Jakarta also have an influence on this, and 65% of population lives in coastal areas. And risks of climate change impact particularly to the health sector. You see that water scarcity, health quality decrease, food scarcity, right? And it's also impact to the GDP. And disaster caused the climate change is about 80% in Indonesia. And estimation of the sector losses from the impact of climate change and health is about 21.6 billion of national GDP. Next, please. Yes, this is the figure of Indonesia about the distribution of disease cases due to climate change in Indonesia. We have ISPA in Indonesia, but that's a acute respiratory infection. So it's mostly in Java and part of Sumatra. It's mostly in big cities. And you know, if also Sumatra and Kalimantan, many palm oil plantations, they're open the forest, doing the fire forest, etc., cause the haze is because particular Kalimantan island here is mostly peatlands. So if a dry season and many hotspots, and it's create haze, and also cross-border to Malaysia and Singapore. So this acute respiratory infection is caused, and it's yeah, it's very bad. And also I have experience when haze in Kalimantan, and I visit to see the HIV program at the time, but at the time it's haze and we cannot see, and also the haze also is bad for our lung. And diarrhea in Kalimantan, and also tuberculosis, right? Mostly in density population, density cities in Jakarta, Medan, Surabaya, etc. And dengue. So we have also challenges on dengue, just because this climate change make a faster cycles of the mosquitoes, Aedes aegypti, and also smaller, just because the fast cycles, and just because small, it's very light, and it's easy for them to follow the wind, and also the coverage is more far away, and it will be create the coverage of this disease is always is more and more far away. And also pneumonia, and we have also islands with dry islands, such as Nusa Tenggara. So they have a problem with the food security, and the sanitation, etc. So it's caused wasting, stunting, and underweight. And malaria is mostly in eastern Indonesia. So there's kind of diseases, and also we still have a challenges to bring evidence between the more evidence, I mean, related between the malaria, for example, tuberculosis, with the climate change. So I think that MSAs have expertise on this, so to bring the all evidence, communicate with the government, and develop the program of technical assistance on this. Next, please. Yeah, also the next about the AMR and climate change. Sometimes we hard to find the connection about the antimicrobial resistance and climate change. The climate change impacted human health, animal health, and food plant and ecosystem. So regarding health and climate change, cause people and animal could easily impacted to the microbacteria, get sick, get diseases. Then more antimicrobial drugs will consumption. Sometimes they're taken not according to the doses. It create the resistance to the drug. And in Indonesia, there's 5 pathogens to be aware. I try to write this. It will be a bit hard for me. Exerceria coli, Klebsiella pneumoniae, Acinetobacter baumannii, Staphylococcus aureus, and Streptococcus pneumoniae. So those mycobacteria commonly cause the peritoneal and intra-abdominal infections, lower respiratory infection, and all related infection to the thorax and bloodstream infections. So the number of deaths based on the Ministry of Health report, the IM caused by AMR in Indonesia is reached about 1.2 million people. And MTAPS Indonesia recorded in 2021 amoxicillin expenditure up to in USD $135 million. So it's a part of the big 20 drug expenditure. So it's consumption by Indonesian population here. Next, please. So next slides is about the climate change response in Indonesia. So the mitigation, our government do the supervision and law enforcement of plantation companies that clear forest land and cause forest fires. It's also improved that yeah, usually every years we have a haze from Sumatra and Kalimantan. Nowadays it's not really big issues, and it's just because the law enforcement for our government. So Indonesia has also rehabilitated 3 million hectares and degraded lands and 3 million hectares of peatland. It's also reported last time in COP by our president. Also net zero carbon 2060 program. So also Indonesia plan to have new capital city in East Kalimantan. The concept is 75 green land, green building, electric vehicles, no gasoline vehicles allowed in this new city, and smart city concept and sustainability concept. This is opposite for of Jakarta, our current capital city, that we have challenges for the air pollution, sanitations, and sea level also still increase, etc. And also we have the climate villages program for villages classified as vulnerable to the impact of climate change, and also villages as very high in impact. So it's about, I just adding this is about 7,300 villages that have the vulnerable to this climate change. And for climate villages is covered about 3,000, and 270 villages are involved for this program. So it's still need to improve in Indonesia. Also, malaria elimination work. Provinces, 381 districts have received malaria-free certificates, and also for additional information, tuberculosis also. Indonesia have a plan to eliminate in 2030, and also MSH have a contribution on this through the STB program. The last slide, I think we have about the
Ari,
health
we are
sector.
actually we have already crossed the 1 hour mark. We are 3 minutes
Yes.
over. So if you could just sum it up
Yeah, this
now.
is, yes, this is,
I know
this
this is
is
a
the
very
last
interesting
slide.
conversation. Yes, thank you.
So this is the last slide that Indonesia tries to improve or improvement the numbers of hospital and primary healthcare to prevent or to respond to climate change, improvement of health in settlements, improvement in early detection of disease of outbreaks, and also also to detect the new pandemic, health information system development. Yes, we already have it. Improvement of the government capacity related to health, increase the community capacity, particularly for the climate villages, and strengthening health regulation. And also, since Eliza says about health financing, so we need to also to increase the health financing in Indonesia. So those activities and managing by Ministry of Health, we can see there's always opportunity for us and MSH to work in Indonesia to provide a technical assistance related to climate change and health. Thank you. Sorry if time is over time for my side. Back to you, Stella.
Thank you, Ari. I'm sure all these details, although they took us over the scheduled hour, but I'm sure that they provided a lot of information as well as answers to people who have joined us here, and we're going to ask questions about your work in Indonesia. And now, without any further delay, let me bring in to hand the floor over to Dauda with one question. We're in the COP, and we had these health declarations. We saw 800 billion coming in. What next?
Thank you very much, Stella. Can you hear me? Thank you very much, Stella. First of all, I would like to thank Emirates for the collaboration, working together on to issue the report that Eliza presented. It was a great milestone when we were launching this report alongside the UNGA summit in New York. Yeah. First of all, and let me start by saying that I am based in Paris, working for Foundation S, but I am from Senegal. I've been working for the last 20 years in the field of HIV, universal health coverage, and community health in many countries, 21 countries to be exact, in sub-Saharan Africa, and I also have witnessed the impact of climate change on the health of communities. So it's not something that we are talking about or which is trendy to talk about. It's something that we have seen in communities. You have seen along the Lake Chad, where people are preparing to the next flood to arrive, in the north of Burkina Faso, where the desert is advancing and impacting the quality and the access to healthcare services. And then we are seeing in Malawi, where people are always preparing for the next cyclone to come and hit population and destroy the already weak health system that exists. So coming back on COP, as you said, the next step would be, first of all, it was great to see that we had a first ever health day, which is really leading us to how we can better position health in climate agenda and climate action. I think this has been really a very important achievement towards what is so needed in terms of positioning and considering health as one of the core actions when it comes to climate action. We have all left COP, and then a number of you has been in COP with a mixed feeling. One is that they are very critical and very important achievement. The fact that the loss and damage fund has been set up, the fact that there were commitment, especially from to invest on the impact of climate change on health. The Climate and Health Declaration has been signed by 143 countries, and also the financing principle for health has been endorsed by 41 donors. So this is all great. And then the next phase is, for me, what is most important, and how do we ensure that the commitment are translated into real action? How do we make sure that funding in getting to the communities that are needed? And we must recognize that the funding mechanism we have for now, as it is making extremely difficult to filter the funding to communities that are struggling to respond to the impact of climate and health. So we need, and we all agree, from the multilateral side to the civil society delegate and the activist, that we need a reform of the health of the financing infrastructure. But we also need to ensure that the funding mechanisms that exist, even at global health, should be more flexible, more accessible to fund and support community-led adaptation. So for me, what is needed for now is the triple F, which is how do we accelerate? How do you fast track access to finance for community-led adaptation? This is for me the most important thing beyond the commitment that was made. We need to recall that the last COP was the 28th COP, and in each edition of the COP, commitment has been made, and very few of those commitment has been respected. So, but when it comes to health, it's our life that are at risk. It is our people that are at risk, and we are in an emergency mode. And we have seen how our health system, how the community system, and the stakeholders has been affected and hugely hit by COVID. And now in many countries in Africa, we are facing also different outbreak of health outbreak that are climate sensitive or climate related or climate generated. So we are really in a situation of emergency to respond adequately to the impact of climate on health. So the mechanism to fund and to support the response that will allow community to build their resilience should be as fast as possible to meet the reality of the impact of climate on health in the most vulnerable country. And Sub-Saharan Africa is amongst them. Southeast Asia, I think our friend Hari has a picture, the real situation in Indonesia, and that same situation could be replicated in Africa or in Pakistan. We have seen that in Pakistan 2 years ago, 900 health care infrastructure has been swallowed by the water and not non-functional for many weeks or months. So the same is happening in Malawi. Cholera has been in Malawi, in Tanzania, in Uganda, and many other countries where we never seen or we have not experienced cholera for a number of years. We know, and then you talked about Ethiopia, that some part of Ethiopia almost never experienced malaria because of the highland, due to the fact that the temperature is rising. They're experiencing now malaria. Dengue, Senegal has never had a problem with dengue or chikungunya. And a few weeks ago, we have had an outbreak of chikungunya and dengue. And I could multiply the examples. So, Stella, we need now to translate the commitment into action and to fast track the funding that is so needed by communities who are at risk to address the issue of climate and health.
Thanks. Thank you very much, Dauda, for hitting the nail right on its head. Yes, I think if we don't have the finance, we can't get this huge, whatever other system, whatever, operationalizing the system or setting up the system, none of that will actually come in, to produce real results. So I guess, translating the pledges and the system, everything into action, and that starts with finance. Thank you for a very key message. And hold on, we are having quite a few questions, and I would like to take a second to just thank everyone for staying with us. We are past the hour mark, but you are staying on, so thank you very much. Do stay on for a little longer because we have a lot of good questions. We can't answer them all, but I will try to answer a few at least. So with that, the first question, again, I would like to take to you, Dauda. And the question is, you just mentioned that the fast tracking the finance access is definitely a key, but there is also an education element here. We also need to educate the people so that they know that the support they're asking for is legit. They know that there is definitely whatever challenges they are facing is due to climate change. So in this context, the question that we have is, what role do healthcare providers and public health agencies play in educating the public about climate-related health risks within the context of universal health coverage?
Thank you, Stella. First of all, let me start by saying that there is a key principle, which is the right response should be locally led and community led response. It has also to be to build the capacity of communities to prevent, to protect, and to be resilient. And by saying though that we can see the critical and the central role of healthcare workers, particularly the community health care workers. That has been, and we have, cholera has shown us how community healthcare worker has been at the first line of defense, which is really navigating between providing care, educating the population, talking to local authorities, and talking to government so that we can coordinate the response. So today, what we need is also to strengthen the capacity of healthcare workers, and because we are expecting a lot from healthcare workers, while we underestimate how huge the capacity to be built of healthcare workers is. I think investing in healthcare workers and community healthcare workers to deliver qualitative services and adapted services for climate-sensitive health issue is something that is needed. But let me say that we come from a context that is particular. I am from sub-Saharan Africa. In the part where I come, according to WHO, we need at least 5 medical doctors for 100,000 people. But in West Africa, we have 1.3 doctors for 100,000 people. And we have 3 nurses or midwives for 100,000 people in West Africa. So to say that investing in community healthcare and healthcare and healthcare professionals and building their capacity to work with communities so that a local response can be built is, for me, extremely key. So, but how can we do that without ensuring that the funding that is needed for the health system is going where it should go in a very fast way, so that we can increase their capacity to do the prevention, to educate people, and then I'll provide the most qualitative and most appropriate healthcare services.
Thank you. Thank you, Dauda, for highlighting the extremely urgent need for capacity building of the healthcare providers. At this point, I would like to ask, Eliza, I have a question for you. And the question is, how should communities work to address the gender impact of climate change on health? And most importantly, I guess, this is the most important part, how should donors and governments integrate gender equity in their response to climate change?
Thanks, Stella. Thanks for the question and the important topic. I can speak a little bit to what we had found, again, in the report in terms of ways to ensure that gender is taken into consideration and kind of deciding around climate adaptation projects. So a few of the ways that we have seen this done in communities that works well is when you have representation on decision-making bodies. So ensuring kind of diversity of perspectives within planning groups, within decision-making, in decision-making processes across all levels, from global to local levels. And as well, into your second part of your question, in terms of funders and donors, ensuring that there's different criteria that maybe aren't necessarily considered in most proposals, but we've seen organizations that have done well in terms of including gender requirements or kind of gender representation in any sort of projects or implementation, as well as different kind of components around justice, so distributive justice, representative justice, so kind of are the folks that are going to be most impacted by what the project is delivering actually making the decisions and feeding into the design. And as we know in the climate space, women and children are highly impacted by the impacts of climate change, just given vulnerabilities in day-to-day movements and life. So including diverse gender representation and kind of criteria in any sort of funding and planning is definitely essential.
Thank you. Yes, it is definitely very essential. There are, like I said, there are so many questions, good questions. I wish we had the time to answer them all, but unfortunately we can't. But there are some specific questions for each one of you, and I would like to give the floor to Ari now to answer one question that talks about. So here's the exact question, Ari. Can you share the impact of climate change about community health if our level of service is lower than that of health facilities? And what about resilience strategy? I believe what the person and the question is trying to focus is on what happens, how does our climate vulnerability and health risks and challenges increase if our healthcare facilities continue to stay inadequate? Yeah. And how do we build resilience as well? Yes, please.
Yes, thank you. So the Ministry of Health also focus on how to strengthen the health systems, right? For the hospitals and primary health cares providers, particularly in the vulnerable area. So we have a problem with the dry area and also high sea levels, happens in some of our islands, etc. So actually for climate change response led by the Ministry of Environment and Forestry and Ministry of Health, part of the member of this. And you know that since we already know about the diseases caused by climate change, then our government tries to make sure that the supplies of drugs and also the information system early detection to make sure that, or if there is an outbreak of disease, for example, malaria, etc. So it's ready, the government ready to respond it, to make sure that everyone who impacted by malaria being cured, and they're here, dengue, etc. So also that's the thing that although this is not 100% perfect, Indonesia still need some improvement actually, but actually using technology to do the communicate with the primary healthcare to the hospital, do the to make sure the referral system, etc. Although yes, we also have a problem with the limitation of the healthcares and also the facilities, right, in primary healthcares, but the government tries to improve and also adding numbers of the healthcares in Indonesia.
Thank you. Thanks, Ari. So I believe that, yeah, the effort is still on, and it's continuing, and probably we need to gather the pace a little bit, but it needs to keep going, So with that, thank you all very, very much. Like I said, thank you first of all for staying with us, for joining us, not leaving us in the middle. And thank you to all our panelists for your very insightful presentations and laying out the most important steps ahead that need to be taken, where we need to focus, the greater focus to be, and also kind of giving us a reality check of what is happening on the ground level. With that, I would like to thank you all again, and it's been a great pleasure to have this conversation with you, and hope to see you again. And for those who are still here with us, if you want any more information, please do look into the chat. You will find a lot of resources. And if you want to, I know we couldn't answer all these questions, so if you have further questions or you would like to engage more with MSH, please follow them on social media, on Twitter, and you can also write questions, send emails, and we'll make sure that our esteemed panelists here get those questions and answer them. So with that, thank you again, and good morning, good day, and good night to all.
Thank you, Stella, for your fabulous facilitation.
Thank
also.
you. Thank you, Stella.
Thank you, Stella.
Thank you,
Thank
everyone.
you. Thank you.
All right. All right.
See you. Bye.